Hey, good afternoon, everybody. We'll give folks just a minute here to get logged in and connected. Hope everybody's having a great Thursday. Another week is almost behind us. I want to welcome you to day 4 of the Georgia HFMA Virtual Payer Forum. My name is Bill Ikest, and I've been the moderator this week for the Payer Forum. I hope for some of you, I'm sure you've attended some of the sessions earlier in the week, and I hope they've been informative. We'll get started here in just a minute. We've got several people who are still getting connected since I opened it up, so we'll give them just a minute. We got a wonderful session for you today. One of Georgia HFMA's favorite healthcare professionals, Miss Janey Griffin-Weaver, is with us today. And so we'll get started here in just a minute. I've got a few comments that I want to make as we get started, and then I'll turn it over to Janey. But like I said, we've still got some folks dialing in. So let's give them just a minute. I would ask you to, if you have any questions about the presentation today while Janey's presenting, please ask them in the Q&A section of your screen, and we'll be sure to have her address those. And if for some reason we can't get you an answer today, we'll be sure to follow up and get you that information. The presentations from this week will be posted on the Georgia HFMA website. I'll show you that at the end of the presentation, how to access those. But yeah, all right. I think we should probably go ahead and get started. So again, let me welcome you to day 4. My name is Bill Ikest, moderating the session today, and I just wanted to thank everybody for joining us. Hope you all are doing well. Gosh knows it's been a different time, and I, for one, have always preferred to visit with people in person. But the times we're in just have really not allowed that. We've had to change it up a little bit. And Georgia HFMA believes in their commitment to keeping the lines of communication between providers and payers open. As many of you know, we've been hosting these payer forums for several years, and we were not able to do one in the spring, but felt like it was important enough to pull together the payer forum for you for the fall. So we've had a good week so far. We've got DXC and Medicaid today, and then we have Ambetter presenting tomorrow. Again, all of the presentations will be posted to the Georgia HFMA website. But, you know, I have to mention as we start this out, I mentioned yesterday how excited I was for the Atlanta Braves going up 2-0 in the National League Championship Series, and then bam! the unexpected happened last night, and they got spanked pretty good by the Dodgers. But hopefully that was a fluke, and they'll get back at it tonight and bring home at least the National League Championship crown and move on to the World Series. So just want you to support those Atlanta Braves. Again, any questions that you have during the presentation, be sure to include those in the Q&A section down below. As I mentioned, we have DXC today and with Medicaid, and Janey Griffin-Weaver, who's a longtime supporter of Georgia HFMA, has been kind enough to join us again today. She had a couple folks that were hoping to join her today who were unable. Janey handles the south part of the state, but she's certainly familiar with a lot of the issues that you all might be facing, and so she will cover some of that today, and we will follow up with some discussion at the end after she's done with her presentation. But with that, Janey, I will go ahead and turn it over to you. Thanks so much for being here today.
Thank you, Bill. Good afternoon, everyone, and I want to thank you all for attending this as well. And as he stated, we are in different times now, so we have to reach out and communicate the best way we know how. So we'll get started with the presentation that you see here. And basically, the first screen that you're seeing pertains to our mission. And this is the statement that you will always see at every presentation that we do. So we want to make sure that everyone is aware of our mission, as well as us being dedicated to a healthy Georgia. The agenda that I have for you today will pertain to the inpatient Part B only claims. We still have a couple of things that's going on with those, and we want to make sure that all providers are adhering to the process of that. Then we're going to talk a little bit about the attachment codes. There are still some providers that's using the incorrect attachment codes, but we want to be sure everyone is on the same page, because we always want to make sure that you're receiving your reimbursement in a timely manner. Once we've completed the attachment codes, we'll go over a couple of the updates that we have available for you all. So get ready, have your pens and paper ready to write down a couple of things, and we'll begin with the presentation. So as I stated, the first thing we're going to talk about pertains to the inpatient Part B only claim submission. So everyone is aware on how your inpatient Part B only claims need to be submitted. And these are the claims that should be submitted when the member doesn't have the Part A, or the Part A benefits has exhausted, but the member does have the Medicare Part B services. With these particular claims, there's going to be certain guidelines that have to be submitted with them, because this is how these claims are identified. So it's not pertaining to the crossover claim on an inpatient claim. It must be submitted as you see here. You're going to submit your Part B charges to Medicare. Once Medicare processes the Part B charges, then Medicare will either cross the claim over to Medicaid, or you, the provider, will need to submit the outpatient crossover to us. Once we've processed the Part B portion as a whole, then that is when you, the provider, must submit the inpatient. When you're submitting that inpatient claim to us, the inpatient claim, and this is where we're running into the problem, the inpatient claim must be submitted with all your charges. Those charges will include the Part B as well as your Part A. And you must include all the EOBs with that. Once we process the claim, we're going to process it according to the DRG, because it's an inpatient claim. So you're being paid according to the grouper. And all of these inpatient claims must have an authorization on them. We've began seeing them where providers are submitting the inpatient claim, but they are not including the authorization, thinking that because the member had Medicare at one time, an auth was not needed. However, again, this is a special circumstance, so you do need an authorization on these claims. So once we receive all of that, when we do process that claim, we will deduct the payment that was received for the Part B portion. Okay? So there will be some of the inpatient Part B only claims that will require the DMA 460. However, your Medicare as well as the Medicaid EOBs will always be required. And that is when you're going to indicate those payments with MB as well as MC. Even if Medicaid does not make a payment on the claim, or even if Medicare is saying no deductible or co-insurance is due, you still are required to submit that EOB with that claim for the inpatient services. So please do not leave that off. We did go ahead and update our presentation for the inpatient Part B only process, and you will be able to pull that presentation from our the Medicaid provider notifications that was posted August 7th of 2020. So please, you can go out there and pull that, and it gives you step-per-step instructions on how these claims must be submitted. Okay, it's also very important for you all to know that your from and through dates of service for this inpatient stay must match your EOBs. On the screen that you see here, these are a couple of the denials that we've been receiving. So we wanted to make sure that you're following what needs to take place with each one of these added denials and what they mean. So the 1770 that you see is stating inpatient Part B claims require an EOB and or the exhaustion of benefit letters. My thing for this is, I tell my providers all the time, due process of elimination. Although you may have submitted the EOB attachments, but you don't have the explanation of benefits attached to it. So go ahead and submit that, resubmit the claim with your EOBs as well as the explanation of benefit. So then we have both of those on file, and your explanation of benefit or exhaustion of benefit does indicate when the member's eligibility either terminated or exhausted for those Part A services. The 1771 is stating the inpatient Part B claims require the Medicare's payment amount. So sometimes you're sending that in and you do not have the correct Medicare payment amount on it. So look at your claims and assure that when you're submitting, make sure that that Medicare amount is correct. If you have 3 Medicare EOBs and there's payments on all 3 of those EOBs, you need to total it up as one and include it on that line for your payments. Same thing goes for the Medicaid, which is the 1772 denial edit code that you receive. Again, assure that all of your payments are matching up. The 1774 is indicating one of the following attachments is missing. Either the Medicare Part B EOBs for the dates of service or your benefits letter. So that may be one that you see that includes the 1770 as well. So go right out there and upload both of them to assure that everything is showing as required. Your 1775 denial edit code, dates of service on the claim does not match the dates of service on your EOB. This is what I stated when I was giving you all the criteria. Your from and through dates of service must match your claim. Okay, so assure that you have on there the same dates of service that shows on your EOBs. Your 1776 denial edit code is saying that the payment does not agree with the EOB, as well as the 1777. One is for Medicare, one is for Medicaid. So the problem that we're running into with these is that you're missing your payments. Everything is not showing the way that it should be. So you have to, again, total all of that up. Look at your EOBs that you're receiving from Medicare as well as Medicaid, and make sure that those totals are matching. If it does not match, you're going to receive those denial edits. So please, please go back over them. If you get these denials and you have this screen here to show you what your next step should be, what exactly is it you need to do to get that claim to process appropriately. We're going to talk a little bit about your attachment codes. So in November of 2010, we decided to upgrade our attachment codes. Although you, the provider, when you're submitting your claims, you're seeing multiple attachment codes out there, but we wanted to break that down a little more better for you all. So with that being done, we came up with the selected attachment codes that are required for your claims. And keep in mind that, May of 2018 is when Alliant Health posted the banner message that stated with their claims, all of your documents must be attached to the claim. And that was due from an audit that was done to our company saying that Whenever we're processing your claims for reimbursement, if there are any type of clinical documentation that is required for you all to receive that reimbursement, everything must be attached to that same claim. So this is why that policy clarification of the DMA 520A was posted out there for you all, and that's why you have to follow that. So we still have some providers that's trying to fax in the medical records. You cannot do that. If you're trying to submit it on the DMA 520 or 520A and you have not attached it to the claim, you are receiving the correct denial. So it must be attached to the claim. Your ICN number, if it's coming from your clearinghouse and you have attachments, it should be an ICN number that's beginning with 21. If you, the provider, has keyed the claim in, or you're resubmitting the claim and you're gonna attach documents to it, then those documents and the ICN number on that should begin with a 23. So with those two codes, we're going to talk about the correct attachment codes that must be submitted with them. So as you see here on this screen, you see our old attachment codes that was used, but now you see the new attachment codes and you see the type of documentation that has to be submitted with it. So if it's your admission, if you're submitting, the AS attachment code, that could be used for your admission summary as well as your H&P or your progress notes. If you're using any other attachment code and it's dealing with those three, you're using the wrong one. So you have to go with what we have here. The B3 attachment code, as you see, is only for your physician orders. The B4 attachment code, this is what you use when you're dealing with your hospice attachments. So as you see here, it's for your hospice revocation forms, the election forms, all of that, anything that pertains to hospice, your non-hospice documentation, all of that has to be submitted with the B4, okay? The CT certifications, this is being used for what you see listed here, as well as your sterilizations, your hysterectomies, your abortion forms. These are strictly for those forms. Your DA pertains to your dental documentation. The DS is for your discharge summary. EB will be used for your EOMBs, your TPLs, your remittance advices. This is also going to be used for your exhaustion of benefits letter. Okay, so that's what you're using there. The NN is for your nurse's notes. OB is your operative reports. The OZ should always be the last attachment code that you submit on your claim. And it should only be used for the documents that we do not have an attachment code for. So that is when you would use OZ. And this is what we've been running into with the providers. You're submitting your clinical documentation, but you're submitting it under OZ. And sometimes it's denying. So if it denies requesting that documentation and you've used OZ, then you do have to go back, resubmit the claim, and attach those documents with the correct attachment code. So your claims will process accordingly.
Janey, and as how many lines for attachments are allowed?
As far as I know, we haven't had a complete number as to how many can be submitted. But I've seen up to 5, 6 on a claim. And the way that goes is if you have EOBs, so with your EOBs, Medicare, Medicaid, your exhaustion benefits letter, all of that can be put under that one code. If you're attaching clinical information with it, then that's when you can separate it based on what you see here.
Okay.
Okay. All right, so now we'll talk a little bit about the updates that we have. I heard Bill when he said DXC technology. Well, we said goodbye to DXC technology, and we've remarried to Gainwell Technologies. So you all may receive documentation from us where it is now saying Gainwell Technologies. That is our new name.
How many name changes is that for you now, Janey?
Oh, I laugh at it, Bill.
At least 3 or 4 that I remember.
It's way over that.
Yeah.
But one of the things that I said was we have been acronyms forever. So this is the first time we really have a true full name. You know, we've been ACS, EDS, CDC, HP, HPE, DXC. Now we have a name of Gainwell.
Yeah.
So that's where we are now.
We'll get used to it.
Yes, sir. The next update I have for you all pertains to the DRG rate increase. So we've been receiving CTNs from provider asking when would that go into effect? That is something that Gainwell Technologies as well as DCH is still reviewing. Once the review has been completed, then that is when that communication will go out, as well as normally what we do is we'll go back and do a mass adjustment for those type of claims, because this only pertains to your inpatient. This doesn't affect your outpatient claims at all. So it's only your inpatients. And we'll go back to January 1st of 2020 and we'll do the mass adjustment. So your claims will process accordingly. What that version will be as of now, we are not sure. We can only tell you that it is in review. So once that mass adjustment takes place, you know, you, the provider, only has 30 days from the date of the mass adjustment to communicate to us if you feel as though your claim reprocessed incorrectly. So if you begin to receive 52 ICN numbers on the remittance, and there's multiple 52 ICN numbers on there from your inpatient claims, if there has not been a banner message posted, then I would recommend you, the provider, pick up the phone and call the contact center to confirm what that mass adjustment is in reference to. If they indicate to you that the mass adjustment was due to the inpatient stay and you feel as though some of the claims processed incorrectly, then that is when you will then create that CTN. If it's not due to the inpatient DRG rate increase, then they'll be able to tell you exactly what it is for. But that is the way that you need to indicate or find out what that's about.
Janey, question just came in. Will email addresses be updated since the changeover to Gainwell, i.e. contact to provider services or to EDI?
Well, right now you will do as you always should be doing, which will be submitting your concerns, your requests by creating the CTN first. Once you create that CTN first, it will come across the proper way for us to respond back to you. But we've been stating that for a while. Always create your CTN before you go into submitting an email out to the, to the staff at Gainwell Technology, because we want to always assure that your request is not only being tracked, but we use those CTNs for our audits, and that's also what help us to get our presentations together. So please just start off with the CTN, and upon that, we'll respond back to you that way.
Thank you.
Okay. The last update I have pertains to the COVID-19 procedure codes that was implemented August 1st of 2020. So you all are receiving claims that are denying, that's either saying the procedure code is not on the contract billing rule or the procedure code is not listed. If those codes are due to the August 1st, 2020 procedure codes from COVID-19, those are in review with Gainwell Technology as well as DCH. As of today, we have no ETA on when that will be completed. However, once it is completed, we have asked if they would allow us to create a banner message to communicate that out to the providers to let you know what your next step will be. But as of now, all I'm able to tell you is that it is in review. And once the review is completed, we'll be able to tell you what the next step action will be. What I will recommend that you all do to keep up with those is, if you're having claims that are denying for that, and you've already indicated or you've identified that these are due to the COVID-19 new codes, keep a spreadsheet with those ICN numbers on it. So once everything is resolved, and we want you to start either resubmitting those claims or we state we're going to do a mass adjustment, then you can always do process of elimination and have your checks and balances in place to look at that ICN number and see if it was either reprocessed if we do the mass adjustment, or to assure that you resubmitted the claim if we're telling you to resubmit.
Janey, can you name some of the codes that you were referring to?
Not off the top of my head, because if I do, I have to leave out of this screen and go over to another screen.
Yeah. No, that's okay.
So,
that's okay. If you have something you can share with me later or whatever that might
yeah,
help.
I do, and I'll give you that, but it is a enormous amount. So what you, the provider, needs to do is, when you receive that denial, you all know how the procedure search panel works. So if you go in there to that procedure search panel, and I want to say some of them are with some of them have a E code that's starting off. Some of them is with a W code that's starting off. It's going to be multiple. I mean, it's a list. It's a long list. So I basically have a small amount of them on my spreadsheet. But once we identified that it was multiple, I stopped keeping up with them. And I just said, we'll wait until DCH and Gainwell completes their rewrue.
Janey, we had another comment. We had another comment related to this. Is please be sure to pay special attention to the add-on payments like newborns in rural areas, that they get a bonus payment. The last time they did a mass adjustment, apparently y'all forgot to take into consideration those bonus add-on payments for newborns. So that's emphasized here. If you can just make a note of that on your end.
I'm writing it down as we speak. But when that happened, I'm hoping that whomever that provider is did submit those claims back over to us to state that, so they could receive their proper payment. But I would definitely send that over.
Okay. I've got one more if you're done with that, with your comment for that one.
Yes, sir.
Okay. What action should be taken when an inpatient account denies due to no retro date on the eligibility screen?
Then that is when you, the provider, needs to get with the member and have the member go back either to the defects worker or the SSI worker and tell them that that 962, I believe it's a 962, is needed.
Okay. That could take some time.
Yeah.
Connect, to connect with the patient. So there's nowhere else to find that information.
No, sir, because
your system is going to have the date that person was retroactively eligible, but is there somewhere else that they can find it?
No, sir. That's where it's going to be. And the only time we get it is either when the caseworker, DFACS, or SSI sends it in to us, and we update it like that.
Yeah, yeah. And just to follow up on the add-on payments for newborns, this particular provider did get their payments, but they had to communicate that there had initially been a processing error. So
okay,
just important to figure that in.
Yes, it is, and I truly appreciate them bringing that up. So I will pass that information on just as soon as we're done with the call.
Okay, thank you for the questions, everyone. Keep them coming.
Okay, so basically now we're talking about the contact us, and I'm sure everyone is familiar with this. We just try to make sure that you know how the process goes. So when you're trying to contact us through the portal, you are always supposed to start with the portal or either by calling. So if you're in on the portal, you're going to select the portal. Upon you doing that, it'll bring you over to the contact information. Once you're there, the screen that you see here and all of this that's showing here may not be available now, but you all know you need to either contact your provider service rep, if it's claim status or any of these other things that are available to you. We're asking you to select that item. Once you select that item where you see the how can we help you information, then that's when you need to give the detailed information for your concern. ICN number 12345 denied for whatever it denied for. Can you please review that because you feel as though that was an invalid denial? When you do that, you provide us with your contact method. If it's a phone number, as I state all the time, make sure you're giving me a phone number that has a voicemail. If it's not a voicemail there and I try to contact you, if you don't have a voicemail, you're not going to know what was said or what I researched for you or any of us research for you if you're not given that. Make sure you give your name as well. And that's important because you all know how HIPAA is. So if you provide a phone number and you don't provide us with a name, there are still some systems that you all have set up that would just say you've reached phone number 12345. Please leave a message. We will not leave a message due to claims because this is private information. It's confidential. And if it's not your name that's on there, we should not be leaving that. Okay. Last on this, where you see right up here at the top, your tracking number, this is where you'll receive or see the tracking number that we've given you for this issue. So make sure that you're leaving detailed information. Make sure that you leave a valid phone number or even an email address where we can respond back to you. And make sure that your name is on that voicemail. The screen that you see here just breaks down the different counties that we serve based on the territories. And the screen that you see here pertains to the reps that are responsible for each one of those territories. So if it does not pertain to hospital, Territory 1 through 10, as you see here, will be the names of those reps that will handle all of those other categories of service. I'm receiving CTNs where it could be for a physician's claim, but you're entering the information for the hospital. So you're providing a hospital provider ID number. Then you're receiving that CTN back indicating to you that you need to include, or you need to have the provider ID number, the correct provider ID number, I'm sorry, that pertains to that claim. So if it's a physician, if it's SNF, if it's any of those other categories of service, then the reps that will handle those would be from Territory 1 through Territory 10. You just need to use the correct provider ID number. Sherida and myself only handle hospital category of service 010 and 070. And to break it down a little bit further for you, Sherida's territory is territories 1 through 5. My territories is territories 6 through 10. Okay?
How's everybody treating you out there? Pretty good?
Oh, yes. Yes, we're just missing seeing one another. So
Yeah.
we still do our conference calls, you know, so I keep all of that going quarterly. So everyone is still abreast with what, you know, what's going on.
Are there
Working from home.
any common issues that you seem to be discussing with everybody that you talk to? Anything in particular that keeps coming up?
No more than the claims that are denying for COVID. That's what our biggest problem is. Those that are denying for the COVID-19. And I'm telling providers, we're telling providers, just as I just stated, with how they need to tackle that. And we, with us updating the inpatient Part B onlys, we're hoping that that would help with the new presentation out there, because we have some new reps that's processing these, not processing the claims, but submitting the claims from the providers that's not really familiar with how that goes. And I think every now and then there are some things that we do need to revisit that are important. So that is one really, really big important thing that goes on for providers, because if they're missing submitting all of the total charges to those claims, as I stated, there's a possibility that they could lose reimbursement for an outlier. So that's really the main importance of those being submitted the correct way.
Okay.
Yeah, so the screen that you see here is basically giving you our phone number information and our dates of operation and the times.
Okay.
When you're on the contact us, if you're doing it by phone, you have options that you can select instead of just holding the phone that would direct you over to the proper area for your concern.
Okay.
And that's the end of my presentation, Bill.
Wow, how about that? Okay. I'm going to just do something here real quick, and I'll put mine back on. So, good. Any information that you have just as it relates maybe to the upcoming budget year? I know that's been signed off on, you know, with regards to Medicaid. Have you heard of any impacts that it might have at this point for your organization, or anything for folks to anticipate as we move forward?
No, sir, we haven't. I had on one of my conference calls, one of the providers had asked me the question in reference to the CMOs with how they're changing over. And as I stated to her, that information I'm not privileged with at all. Okay. But as far as Gainwell Technology, DCH has not shared any of that with us.
Certainly the state has been impacted financially, right, from what's happened over the last several months. So I suspect we're going to feel a pinch somewhere, but you know, that kind of remains to be seen. And then we get to figure in a presidential election. And
Wow.
what that's all going to mean, what that's all going to mean for it. You know, I mean, the talk obviously is that if the Democrats win, they'll do away with the Affordable Care Act, and or I'm sorry, if the Republicans win, they'll do away with the Affordable Care Act. But I think the hope is that they're just going to restructure some things. I can't imagine anybody sleeping well at night knowing that they haven't supported providing people with pre-existing conditions the appropriate coverage. So
Absolutely.
anyway, this is not a political forum. This is a payer forum. So I will stay in my lane. I know there are probably several people on the call that could get pretty fired up if we wanted to start talking about it. But
exactly.
Yeah, but we'll see what happens. You know, I mean,
yeah.
all you can do is try to be hopeful and keep moving forward. So I think we did have a couple more questions. Oh, yeah, I should have known to ask this, and I appreciate the question coming in. Any updates for telehealth as it relates to telehealth for provider offices? Are you continuing to provide the telehealth benefits and coverage and whatnot that at least through the end of the calendar year?
Yes, sir, we are. We haven't had any more updates on that. So process will continue to be as is with those type of claims.
Okay. Okay, hopefully that answers the question. We've got a little bit of time. I would encourage anybody, any questions at all that you have for Janey about any of the pictures behind her in her office or or anything. Anything you want to ask at all. I mentioned again, one of the things that we always have to remember, and this is similar with Palmetto GBA, it's kind of like a three-legged stool, right? Gainwell now is really reports to the Department of Community Health. And so they're really dependent on them for their direction, their guidance and whatnot, the same way that Palmetto GBA is dependent on CMS. So, they're not always going to have everything in sync. It's going to make sense that maybe there are going to be some issues from time to time, but, and I think in some of the comments, Janey, I did hear from some folks that sometimes DXC, now Gainwell, will say that it's a DFAX issue, and DFAX will say that it's a DXC or a Gainwell issue. So, you've probably experienced that over the years, just getting the information consistent, perhaps across both systems.
But when they run into that, Bill, and they are absolutely correct, because I've seen those as well. When they run into an issue like that, what they need to do is ask that DFAX worker, did they submit that 962 over? And if they're saying that they submitted it over, when the provider creates the CTN, they can put all of that in the notes. And what we do is we go into the member's file to see if it's there. Mm-hmm. If it's there, then we can have it sent back for reprocessing or updated.
Right. But then what's the process? What's the process for uploading that though once you receive it?
Well, that's something that when it's coming from DFAX, then members eligibility handles it.
Okay.
But if it's in a CTN, if they submit it to me, I can go in there and I'll be able to see whatever documentation is in there that the DFAX worker would have stated. So okay. Once I see that, then I screenshot it and I send it over to member enrollment to say, hey, this is what it's saying, and they'll go ahead and update it. Once it's updated, I'll communicate back to the provider and say, the system has been updated, go ahead and resubmit that claim back through.
Okay. Okay. Got it. We have another question. We've already got people using the Gainwell name. They're already figuring it out instead of DXC. Good. Are there any plans for Gainwell to do roster audits or cleanup anytime soon?
I don't have a clue. They haven't said anything about that.
Would you maybe just inquire and see if there's any talk about that, and just communicate back to me, and I'll try to share that with folks out on the documentation that I share with them on the website. That would be good, I think.
Right.
Yeah. What if the patient is unable to get in touch with their caseworker, or the caseworker is slow with updating the files? What would your recommendation be in those situations? That's no secret, Janey, that, you know, there's been talk forever
Right.
that casework, not just in Georgia, but caseworkers in general have a pretty full plate.
Right, and I understand that, but unfortunately, that's the route we have to go, because we cannot just go by, let me see a better way to put it. So there are some documentations that are really considered to be legal documentation. That information is one of those. So we have to have that. There's no way around it. We have to have it.
Mm-hmm. There's no way to escalate an issue, just like you would with a claim. If a claim's not getting resolved, there's no way to escalate the issue with
not with that defects worker, because that's out of our circle with that part of the entity. Mm-hmm. So what I would recommend to that provider is you're going to have some type of way to either get with a caseworker. It may not be that one, but it may be one within that area. And if you're not receiving a response from that, then maybe, you know, after you've done everything you can do, and I'm glad that this just hit my mind, but then create the CTN. On the CTN, we need for you to be as detailed as you can. Caseworker stated she did A, B, C, D, E, and still as to this day, there has been no resolution. And what we can do is submit it over to DCH, because they would be the ones to communicate with that caseworker at that time. But I want you to really do your due diligence first. Don't just send it to us and say, hey, can you update this? Because the response is going to be, you have to go through the process. Mm-hmm. So if you follow those steps, then I would say that would be the only escalation bill that we would have to forward your concern over to DCH and get them involved.
Okay. Okay, great. Great. Thank you. Well, I'm not seeing any additional questions come in. I am very appreciative of your time, Janey, as always. Mm-hmm. It's good to see you, even if we're not in the same room together. But thank you for your commitment to providers in Georgia over the years, and your willingness to help them better serve their communities. So thank you for that. Let me see here. I got one chat comment.
Hey, Donna.
Yeah, a banner message was posted a few months ago that lists the DFACS contacts and how to escalate. So that's good to know. So in the chat, a banner message was posted a few months ago that lists the DFACS contacts and how to escalate. Thank you, Donna, for that. So let's see, a couple things I want to share with the group. Janey, I'm gonna kind of call you out here, so listen up. So folks, assuming that in 2021, early 2021, if we get back to where Janey can make visits in person, if you schedule that visit, you be sure to have her bring you some cookies. She and her daughter have been doing some bacon. During this pandemic, and they're who knows, they might show up at your door with some goodies. So it never hurts. It never hurts. And we're ask, right?
Yes, and we're under Sweet Blessings Unlimited.
Sweet Blessings Unlimited. Okay, that's great. All right, I'm going to share my screen real quick so that I can share with people how to access the presentations from this week. So you should be looking, this is the Georgia HFMA chapter website homepage. And what I would, hopefully yet this week or early next, we will have the presentations and the webinars posted. You need to go to the media tab over here. You need to drop down to the document library, click on the document library, and that will take you to this page, and you'll see an In Case You Missed It section. Click on that In Case You Missed It section under 2020. We will have a separate folder set up under there for the Fall Payer Forum, and you should be able to find the documents there. We had a problem with the recording with Cigna on Tuesday. For some reason, the recording stopped partway through, but then was resumed. But all of the others were recorded. So if you missed one or you had trouble getting in, feel free to use that. So that's how you get on that. And I'd be remiss if I didn't thank the Georgia HFMA corporate sponsors. Their names and the company's names are listed on the chapter website as well. This is a different year for all of us, yet we still need that support of Georgia HFMA. Georgia HFMA and HFMA as an association across the country is a wonderful resource for providers and business partners to stay connected, stay up on current issues. And this is just really forcing everybody to be a little bit creative and improvise a little bit, but there's a lot of really good information, a lot of really good content out there. So I encourage you to go to the website and look at the calendar of events, of some upcoming events. We have a forum, I know, next week that Lillian Kluk is hosting that will cover several different topics. And then in early November, I think it's November 4th through the 6th, we have a virtual fall conference for Georgia HFMA that's some folks are working really hard behind the scenes to pull all that together. And I would encourage you to look at participating in that event as well. There should be a lot of good content, some panel discussions and whatnot, covering a lot of interesting topics. So with that being said, I know that y'all are out there working very, very hard. I know your organizations are so appreciative of the work that you're doing. Continue to put your best foot forward. Don't ever be afraid to reach out and ask for assistance from someone within your organization. I encourage you to collaborate with other providers in your community to see how they're handling certain issues, but be proactive as much as you can and not reactive. But I know it's challenging. Yeah. I know some days you feel like you're maybe fighting an uphill battle, but just keep moving on, and I promise you will achieve what you're setting out to do. But always.
Bill, I have a question.
Yeah.
Okay, so pertaining to the question that was asked for the roster audit.
Yeah.
Are they talking about as far as the cleanup would go with the providers?
I'm guessing that's what it is, but let me see if he responds. Carl, if you're still on and can respond to, Janey wants to know if you're talking about the providers. I assume so.
Okay, because I got a text message where they wanted to know, is it in reference to the providers? Is that the type of audit they're speaking of?
I'm going to guess so.
I would assume that that's what it is.
Make sure that everybody's still where they say they are and whatnot. So, yeah, I'm not seeing a response come in on that, but I would assume so.
Okay, great.
Yeah. Okay.
Hey, well, that's it.
Yeah. So with that being said, I think we've succeeded in what we set out to do today. Hopefully you've been informed and have some ideas and some information that you can use. But like I said, look for that information later on this week or early next on the Georgia HFMA website. But Janey, again, thank you to you and to the rest of your team. I know some of them jumped on to listen. I just really, really appreciate your continued support of Georgia HFMA. Good luck in the year ahead, and with the holidays being right around the corner, continued good health to you, and we'll look forward to
as well.
We'll look forward to working with you again at future events.
Thank you, and you all stay safe.
Yep.
And have a wonderful year.
That's it. Let's put this in the rearview mirror and get on to 2021, right?
Absolutely. I'm looking forward to that.
Yeah. Thanks, everybody. Have a great day, and we'll see you tomorrow. Better is on the schedule for tomorrow at 1 o'clock. Thanks so much.
Thanks, Bill.
Bye-bye.
Bye-bye.